Hi, today I'm going to be talking about acetaminophen. My name is Olufemi Williams. I'm the host pharmacist at mywebpharmacist.com. So, acetaminophen, it's also known by the brand name Tylenol. It's known as Paracetamol in Europe and in many African countries. It's also another brand name is Panadol, and we also know it as APAP. So today I'm going to be talking about the use and the precautions for this medication. Acetaminophen is commonly used as an analgesic and antipyretic. So it reduces pain and it also reduces fever. It has little or no anti-inflammatory properties. It can be found in many over-the-counter medications for pain and other medications for cold, allergies, and things like that. So it could be on its own, or it could be in combination with other ingredients. It's also found in a lot of prescription pain medications. So the question, how safe is acetaminophen? Because of the current pandemic, a lot of people have gone to buy acetaminophen because they were told that it's safe. Now, how safe is it? Usually, it is very well tolerated at the recommended dose. Now, you shouldn't take more than 3 to 4 grams within a 24-hour period. Now, the reason I gave this range is previously we have always said 4 grams was the maximum in a 24-hour period, but I did a continuing education training recently that said the maximum should be 3 grams. So that means that if you are taking a tablet that has 500 milligrams of acetaminophen, you should take a maximum of 6 tablets in a 24-hour period. A lot of people take, a lot of acetaminophen, but we'll get to that. For pregnant and breastfeeding mothers, it has been found to be quite safe, as I said, if you take it in the right dose. The side effects are also very rare, but there have been some reported cases of rashes and some blood disorders. Now, let's get to the important part. Now, although acetaminophen is relatively safe, it has been found that in the United States, it accounts for more than 50% of overdose-related acute liver failure and approximately 20% of the liver transplant cases. So, as I said, it's relatively safe, but if it's used in the wrong dose, it can be very, very fatal, can be very, very toxic. So what are the factors that affect the toxicity? If you take a high dose, an acute high dose at once, it can lead to a fatal liver failure. If you take alcohol, if you're a chronic alcohol user, it will also increase the toxicity. There are some herbs and medications that will affect the metabolism of the acetaminophen, because when you take acetaminophen, your liver wants to break it down to something less toxic, and if something else is competing with the metabolism of the acetaminophen, that will cause accumulation of the acetaminophen. So even if you're taking it in the right dose and something else is also affecting the metabolism of the acetaminophen, that will increase the toxicity. Age and genetic factors also affect liver metabolism of the acetaminophen. As you grow older, your body might not be able to handle some of these medications as they should. And also, some people have some genetic factors that affect their ability to metabolize acetaminophen. So that increases the toxicity. Nutritional status. Yes, if a person is malnourished, and that includes fasting for a long time, you want to be careful taking acetaminophen because that increases the toxicity. So you should take much lower than the maximum dose. For those who have chronic liver disease, as I said, those who have chronic alcohol abuse, taking acetaminophen, you have to really take a much lower dose, maybe just maximum of 3 tablets in a day, just to be on the safe side. Now, about the toxicity, I wanted to say that sometimes the toxicity is caused by, it's not intentional. People buy a medication that has acetaminophen for pain, and then they buy another medication for cold, and they end up taking much more acetaminophen than they thought they were taking. So by the time they've taken 6 to 8 tablets of the 500 milligram tablet acetaminophen, they also go and buy a cold medicine that also has acetaminophen, and even another sleep medication that has acetaminophen. And before you know it, they've got to a toxic level. And the thing about acetaminophen is you might not even know it immediately that you are taking a toxic level. By the second or third day, it will now have damaged a lot of things, and this could be very, very dangerous. Now, I wanted to talk about acetaminophen for COVID-19 and other infections. So, as I said earlier, people have rushed to buy acetaminophen because there were reports that ibuprofen is detrimental to COVID-19 patients. These are just reports. We are still on uncharted territory with this COVID-19. So we just want you to be careful rushing to use acetaminophen. Now, fever, which is what you probably want to treat when you have an infection, it's the body's way of healing itself. You see, when you have an infection, the body sets a lot of things in motion, and fever shows you that something is going on. Now, the body is also trying to heal itself. It's not just there, but it's also trying to heal itself. And if the fever is mild or moderate, it's better not to take any medication. Just allow the body to keep on working. Now, if the fever becomes too high, you might need to take medication because you want to avoid seizures or convulsions. But as I said, your body is trying to fight the infection, so you do not need to take any medication if the fever is low. I mean, not take any medication, but you do not need to take any fever-reducing medication. You can take your antibiotics, you can take whatever you're prescribed, but there's no need to reduce the fever. Allow your body to keep on working. Now, because if you reduce the body temperature, you might sometimes affect the body's ability to fight the infection. So, now in conclusion, so while I said acetaminophen is relatively safe at recommended doses, you should wait until you really need it. and be careful to take all the necessary precautions to prevent an accidental overdose. I have another article that talked about, for pain, you don't just kill the pain, you should heal the pain. Sometimes, but that's a different article. And you can find this and other articles at mywebpharmacist.com. And just want you to, learn the safe and responsible way to use medications. As pharmacists, we really want to make sure that you stay safe. And please, you can subscribe to my YouTube video below, so that you won't miss any of our videos as they come out. Thank you, and stay safe.